We are looking at the overuse of emergency medical services. An outline of the topics we're going to cover is the problem, defining it, looking at the major stakeholders, giving some alternative solutions, looking at policy change and goals, the impact it will have, some recommendations, and evaluate it. So starting off, the problem of overuse of emergency medical services. The increase in emergency department services has had an increased drastically over the past few years, with an increase of 32% in the United States. The increase, according to researchers, is due to patients using the emergency department as a place of primary health care rather than for urgent health care issues. And according to Laporte et al., 2016, although this issue includes patients from all socioeconomics, there is an increased usage among vulnerable populations of the homeless, substance abuse problems, psychological disease, and lower socioeconomics. The increase in emergency non-urgent services accounts for 40% of patients used in the emergency department. The cost of emergency department charge is 320% to 720% higher than at a walk-in clinic. Some of components unable to get into primary care physician promptly due to the average wait for individuals to see a primary care physician is around 24 days, a lack of insurance, lack of transportation, and the convenience. Also, an emergency medicine is expensive, and the billions of dollars spent annually in the United States is rising. Patients considered high utilizers are among those who increase costs, receive duplicate or unnecessary care. So, Emergency Medical Treatment and Active Labor Act looks at the average wait for individuals to see primary care. Takes about 25 days. They have issues with insurance, and high utilizers increase our costs. Increased usage, the population is homeless, substance abuse problems, psychological disease, and lower socioeconomic status. So a considerable minority of patients who overuse emergency services represent a large amount of utilization of the emergency department overall costs and care. The problem is that the number of emergency department visits in the United States has increased since 2000 by nearly twice the rate of population growth. According to Thornburg in 2019, the two largest groups who use the emergency department are individuals over the age of 65 and children, and these individuals tend to receive health care from community health clinics or are Medicaid insured. An increase in accessible education needs to be given to individuals and families so that they can have a comprehensive understanding of appropriate responses to illness and emergencies. In the healthcare industry, emergency departments are a vital component in providing saving lives treatment for individuals with emergency care needs. Because the emergency department is open 24/7 and governed by the federal law Emergency Medical Treatment and Active Labor Act, emergency departments are not allowed to turn anyone away. The law is increasing the demands of users in the emergency department, and according to Smith in 2017, many components regularly surface in research why individuals visit the emergency department for non-emergent needs. Some of these components are unable to get into a primary care physician promptly due to the average wait for individuals to see a primary care physician is around 24 days, lack of insurance, lack of transportation, and convenience. Extending the hours of primary care clinics and assisting the uninsured to find cost-effective ways to get health care outside of the emergency department are solutions to the policy analysis topic on how to address overuse in emergency medicine. The major stakeholders. A stakeholder is someone or an organization who is involved with or has interest in something. For emergency services, the stakeholders are patients, local community, media, organizations, and those that provide emergency services. The emergency service providers are the front line for caring for patients. By overusing emergency services, this places strain on these providers. They can be overworked and understaffed. Patients are the ones receiving care in emergency services. By overusing emergency services, this could stall care for those who really need it and possibly decrease the quality of care they receive. The community is the population served by the emergency services. By noticing the overuse of emergency service, working with the community can help figure out why the service is misused and how to fix the problem. Media is important for the spreading of information. Local organizations, such as religion, are important because they have trust within the community and can help the spread of information. Some alternatives: we need to look at health literacy. By not understanding health information, it has been found that this is a risk factor for overuse of emergency services. By increasing education on health, individuals will know how to care for themselves and when the use of emergency services is appropriate. Disease prevention: by following up with a primary care physician more frequently, disease can be prevented and managed better. This would decrease the need for use of the emergency services by decreasing diseases. Using the nurse first: this is something that has been implemented by some hospitals to decrease overuse of emergency services. Patients can call a nurse and tell them what is going on. Based on what the patient tells the nurse, they can tell them to be seen in a clinic or the emergency department. Some other alternatives: there are programs for overdose prevention sites, and this is where they are in a safe environment using drugs and they have health staff on premise, and this will help decrease overdosing and using the emergency room for overdosing, and can prevent more deaths because some people die en route to the hospital. And then using telehealth, just like the nurse first, can call a doctor and get information on the phone rather than going straight to the emergency room. With increasing number of non-emergency resources in the community and increase the number of urgent resources for patients with psychological disturbances is a goal of these policy changes. When discussing the overutilization of emergency rooms across the United States, common reasons prevail such as uninsured, lack of hospitals, lack of physicians, and lack of nurses. Too often, the blame is placed on the uninsured who use the emergency room as their primary care services. While this may be accurate to an extent, it only addresses one component of healthcare availability. This article, done by Al-Hassan in 2017, showed that another option is the overwhelmed healthcare system. Increasing access to non-emergent healthcare in the United States could vastly improve care at a fraction of the cost of emergency room visits. Also, many studies have demonstrated that patients experiencing psychological distress utilize the emergency room at higher rates than those that do not. Because these patients take up rooms that could otherwise be used for patients with serious injury or illness, it would be beneficial to have resources available for a subset of patients. Identifying resources and screening tools specific to patients with psychological disturbances could benefit both these patients and the healthcare system. Some impacts to the existing problem: increasing awareness of emergency and non-emergency resources in the community leads to better utilization of the emergency resources. Also, increased ability to care for those in urgent care and psychological needs of the patients can lead to can be impacted by community education and outreach carrying a higher financial cost. Patients without insurance still are at risk for misutilization, though. We do need more money in order to put out these new policies and to support outreach programs. And even with additional money for facilities, patients without insurance will still be at a disadvantage for misutilizing the resources. Some recommendations are: educating the community is the best way to inform and remind potential patients about the most efficient and cost-effective way to care for their injuries. Also, education is the need to change infrastructure to increase physical accessibility of non-emergency and primary care in the community. So with the evaluation, we are going to look at increasing education and appropriate response to illness and emergencies, letting people know when to go to primary care, when to go to urgent care, when to go to emergency room, educating individuals on non-urgent care and urgent care needs, extending the hours of primary care clinics so that they can get easier and more availability to their primary care physicians, and assisting the uninsured to get and find cost-effective ways to get healthcare outside of the emergency room, enrolling vulnerable populations with primary care providers, and decrease duplicate tests and labs by improving healthcare professionals' access to patient records across different health facilities. These will reduce the cost and decrease the burden in emergency departments, as well as help patients manage chronic conditions and new illnesses or injuries. So in conclusion, emergency rooms have had an influx of patients due to people using it as a form of primary care. Those using the emergency room excessively is typically the homeless, uninsured, low socioeconomic status, and those suffering from poor mental health. Services provided affect not only the patients themselves, but the community, healthcare workers, the local organizations, and the media, and they can all work together to bring awareness and help solve the problem. Contacting a nurse first, increasing health literacy, and promoting healthy living along with utilizing telehealth and other safe practice sites will decrease the overuse of emergency services. And goals to reduce the overuse of emergency services is to provide excellent care to all of individuals in the correct setting. This can be achieved by continuing to educate the public on proper healthcare settings for differing ailments, as well as providing enough of these alternative sites and adequate staffing to manage the patients. And here are resources. Thank you for your time.